back to Help I'm Teaching. This is CP once again to explain concepts, debunk myths, and inspire learners on a variety of topics. Today I'm talking about how to teach pharmacology, or the science of drugs and addiction. I'm not taking a health class refusal skills kind of approach to this topic, but a scientific one. If you can get people to understand the way some drugs operate on the biological level, it's way more persuasive than any cheesy school anti-drug campaign. It'll also help them make more informed decisions. This topic is one that's going to be way more understandable and relevant to older kids or even adults. I don't think anyone's going to ask you to talk about physiological addiction or neurotransmission to first graders. First of all, what's a drug? A drug is a substance other than an essential nutrient that induces a physiological effect in the body when taken. So that eliminates food and water. Most things we think of as drugs are psychoactive or affect the brain. Your brain is a tremendously complex organ that consumes 20% of your daily calorie intake. Among other things outside the scope of this episode, your brain is looking to keep conditions from pH to temperature as stable as possible, or in other words, to maintain a state of homeostasis. One way it can do this is by detecting stimuli with receptors. A receptor is a region of tissue that responds to a specific stimulus, in our case, a neurotransmitter. Neurotransmitters are molecules that bind to receptors and produce an effect in the brain. Some you may have heard of in relation to medication are serotonin, dopamine, and adrenaline. The first two are often associated with antidepressants and antipsychotics, while the last triggers the fight or flight response. Neurotransmitter receptors are often targeted by drugs. Most drugs are signaling molecules or affect their release and fall into four categories: agonists, antagonists, partial agonists, or inverse agonists. To visualize these better, let's imagine a receptor as a lock. An agonist binds to the receptor and activates it. Straightforward. It's a key that opens the lock. An antagonist binds to the receptor as well, but blocks it instead of activating it. Imagine an antagonist as a key, but without the part at the top you can turn. You can put the bottom part with the grooves into the lock, and now it's just blocked. No one can open the lock. A partial agonist is a key that can open the door halfway. Maybe some people can fit through, but it's not as effective as an agonist and doesn't activate it fully. An inverse agonist is like adding an extra lock. It doesn't just block the door like an antagonist, it does the opposite of an agonist and sends a signal to do the reverse. If the receptor worked to release a neurotransmitter, the inverse agonist might inhibit it. Biochemical pathways control almost everything in the body, from gene regulation and muscle contraction to assembling and storing glucose and healing wounds. By upregulating or downregulating pathways, drugs can do a host of things to the body. We have several ways to measure drug effectiveness. ED50 is the amount of drug needed to have the desired effect in 50% of test subjects. LD50 is the amount of drug needed to kill 50% of the test subjects. This is a use of animal testing because ethical guidelines do not permit scientists to find the LD50s for humans. The lower the LD50, the more dangerous a drug is. When you divide the LD50 by the ED50, you get the therapeutic index. The higher this is, the safer a drug is, because the dose it would kill you is very far from the dose that it would take to get the desired effect. Bioavailability is an important term in pharmacology and refers to how much of the drug is available to affect your body. If 1 milligram of a drug had 100% bioavailability, 1 milligram would be available for your body to use. If it had 20% bioavailability, then only 0.2 milligrams would remain. Oral consumption greatly reduces bioavailability because some of it will be digested in the stomach. It will also take longer to reach your brain. Conversely, administration into the bloodstream by injection or IV is a bit more complicated but requires lower concentrations and has a shorter time to peak. If you were to inject yourself with drinking alcohol, you get a far higher concentration than if you drank it, and it would instantly cause severe side effects and maybe death. Bioavailability is also affected by body composition, age, sex, genetics, and stress. You shouldn't share prescription medication with anyone because your doctor gave you that amount that, based on all of these factors, is good for you. The same concentration may not work on someone else, or it might be too much. When pharmacologists design molecules to act as drugs, there are a couple of things they can alter to affect onset time and strength. Drugs can be fat-soluble or water-soluble, and each has its own characteristics. Fat-soluble drugs reach the brain much quicker, but can remain in the body longer. Water-soluble drugs have a greater oral bioavailability, but are eliminated quicker. Maybe you've heard the term blood-brain barrier. This describes a fat-soluble membrane around the brain that prevents most substances in your bloodstream from going directly into the brain. Fat-soluble drugs can cross it easily, but water-soluble drugs have a harder time. Size of the molecule is another consideration. Small molecules can cross the BBB faster than big ones. Positive charge also helps molecules cross the BBB. So in short, a small, fat-soluble, positively charged molecule will cross the BBB and take effect much sooner and stronger than a large, water-soluble, negatively charged drug. The barrier is important because some compounds in food act as signaling molecules, and without the BBB, these would have effects on your brain. For example, glutamate is one of the most important neurotransmitters, but it can also be found in high amounts in cheese. Your brain allows glutamate from food, but controls it very precisely with pumps. Without the blood-brain barrier, the neurons activated by glutamate would be overstimulated the moment you digested that brie, and you'd most likely die. Drugs are eliminated slowly over time by the liver and kidneys. The liver transforms them into inactive forms called metabolites, while the kidneys excrete them through urine. Others can also be eliminated in the breath, which is why some medications like anesthesia can make your breath smell. The time it takes for half the given amount of a drug to leave is called the half-life. A low half-life means it's quickly eliminated and may give stronger withdrawal symptoms if stopped. Drugs with low half-lives also need to be taken more frequently. It takes about 4 to 5 half-lives to clear a drug from your body. Now for some questions. Why can't we make a drug that isn't addictive? Remember homeostasis? Your brain is trying to keep conditions as stable and consistent as possible. When you take any medication, you're usually introducing more signaling molecules into your body. When you take drugs over a long period of time, like in an addiction, your body takes notice of the increased concentration and tries to make sure that the receptors are still being activated in the appropriate amounts. Since it can't control the signaling molecules, it does the next best thing and decreases the amount of receptors. What this means is that when you're not taking the drug, the receptor is still rare and it becomes harder for your own body's signaling molecules to interact with it. This added difficulty is what causes withdrawal symptoms. This hasn't stopped science from trying to design non-addictive drugs, though, especially with painkillers called opioids. Scientists are trying to design a drug that targets receptors that block pain, but don't induce euphoria associated with addiction. Methadone is a partial agonist for opioid receptors, meaning it binds weakly and is used in recovery to make withdrawal symptoms easier, but does not induce euphoria. Also, if activating a receptor constantly over time decreases receptor numbers, it's theoretically possible that if you take an antagonist or inverse agonist in small amounts over time, you could increase your receptor numbers, at least temporarily. Just something to think about. What are side effects? As good as we are at designing drugs, the body is an extremely complex mechanism. It's hard to make something that affects just one area because everything's connected on some level. For example, the painkiller morphine causes constipation because it decreases fluids in the GI tract, hardening stool, but this is regulated by the same pain receptors that morphine targets. We also have to worry about off-target effects, which is when a drug binds to somewhere it wasn't supposed to. This is one of the reasons cancer drugs take such a toll on the body. They target dividing cells like cancer, but lots of cells like hair and stomach lining also divide regularly, so they're targeted too. For now, there's no way around them except to keep working to design a better drug. Why don't antidepressants make you feel good like recreational drugs? Yes, they can increase your levels of serotonin and dopamine, but they might act on different places than recreational drugs. For example, mushrooms or psilocybin work via serotonin as well, and can cause visual hallucinations by affecting the visual cortex. However, there's serotonin in your stomach too, and when the serotonin receptors are triggered there, you don't get a wave of euphoria, it just helps you digest food. It's all about time and place. However, this isn't to say that all prescription drugs can't be used recreationally. Things like Xanax for anxiety, Abilify for depression, and Adderall for ADHD are definitely abused. What's the difference between medicine brands? There are lots of medications on the market that do the same thing by using the same compound, and this compound is the active ingredient. What separates medications from each other are the inactive ingredients, which can do things like increase bioavailability, slow absorption, hold a capsule or pill together, and so on. In most cases, though, the same active ingredient is what matters, and this is why pharmacy generics work just as well as brands. Is it possible to have a mental illness but none of the biological signs? Like, if your serotonin is normal, can you still be depressed? Chemical imbalances in the brain aren't the only way someone can become depressed. Cohen and Browning 2015 discussed how controlling diets to limit serotonin production can cause depression in people with risk factors, but it's less likely to do so in a person with none. Things like cognitive behavioral therapy can treat some people because their brain chemistry is in balance, but their cognition, or how they think, isn't. Why do so many plants and animals produce psychoactive substances? The difference between a drug and a poison is the dosage. I learned a lot of examples of plants producing toxins that were used as healthcare in my studies. For example, foxglove is a plant used in crime novels as a poison, but it's also used to treat heart failure in small doses. Someone must have noticed that the poison acts on the heart and guessed it could treat heart conditions. So it's a consequence of evolution and a testament to human ingenuity. Why are some drugs harmful to take with others? Some receptors have multiple sites for different molecules. Some drugs, when bound to one of these receptors, can modify another site on the receptor to make it more or less sensitive. Imagine a mall with multiple entrances, A, B, and C. One day, lots of people come in through entrance A. Next time, not only will entrance A be open, but B and C will probably be expecting more people as well. This type of binding is called allosteric regulation, allo meaning other and steric meaning the position of atoms in a molecule. Allosteric regulation allows for signaling of molecules working together to exceed the sum of their parts. Also, sometimes drugs can affect the same system, but by different mechanisms. For example, imagine a hose. Turning the faucet down a little and bending a hose will both limit water flow, but doing both at once might stop the water entirely. Now imagine the hose is your heart. Be careful. Now, some misconceptions. The concept of drugs that make you smarter is popular enough to have a name, nootropic. Caffeine is actually an example of a nootropic because it's a central nervous system stimulant. As you know though, downing coffee might help with some things like alertness, but hinder others by causing panic or a high heart rate. It's not like you can just drink 7 cups of black coffee an hour before a test and ace it. Being smart is made up of many different factors. Most other nootropics on the market are supplements and do not have verified results. Unfortunately, we're not getting to Lucy or Limitless anytime soon, and maybe that's for the best. Though both can be signaling molecules that affect your brain, hormones and neurotransmitters are different things. Hormones are produced by the endocrine system, travel through the blood, and can act on cells far away from the cell that made them. Neurotransmitters do not travel through the bloodstream, but remain in the brain and act generally over short distances. You actually can overdose on gummy vitamins. Vitamins don't act as neurotransmitters, but serve other roles in vision, coordination, digestion, and so on. Taking too many could lead to excessive production of substances that may function as signaling molecules. For example, taking too much vitamin A can cause blurred vision, fatigue, and hair loss. Some vitamins like A, D, E, and K are fat soluble, while B and C are water soluble, so it's easier to take too much of the former because it stores in fat deposits rather than being eliminated in urine. Other supplements can also hurt if taken in large quantities. Iron and calcium are particularly dangerous as they can be potentially fatal. In short, taking a few extra gummies one day shouldn't hurt, but play it safe and stick to candy if you really want a gummy. Drinking water doesn't directly reduce drug effects, but it can promote healthy kidney function, which does. As far as the drug tests go, drinking a lot of water to flush it out of your system may not help avoid detection and may actually cause you to be retested because technicians will notice a suspicious level of water in your urine. However, drinking water does reduce alcohol's effects, but this is because most of these effects are actually caused by dehydration. Not all drugs are psychoactive or affect the brain. For example, CBD only affects muscles and cannot get you high or relaxed the same way that Xanax can. On the other hand, caffeine, nicotine, and alcohol are all psychoactive substances. Can you recycle drugs after they're eliminated? In some cases, like with THC, the metabolite is converted to something else, THC-COOH or THC carboxyl, by your liver. THC carboxyl is not psychoactive, so you can't take it again. but in others, it's possible. The antibiotic penicillin, for example, has actually been recycled from urine during shortages. What's the difference between psychological and physical addiction? It's mostly going to vary from person to person, but psychological addiction, or dependence, is when you experience emotional or cognitive symptoms like depression, lack of sleep, and needing it to function. Physical addiction relates to symptoms like shakes or increased heart rate, but if you had these symptoms but were still able to stop if you needed to, like for a trip, we could say you're physically addicted but not psychologically. Of course, these lines can blur quite a bit. Addiction to things that aren't drugs are still addictions and can follow similar chemical pathways. Things like porn, gambling, and gaming can all get people hooked. These aren't physiological addictions, but psychological ones. Watching porn, winning at poker, and climbing the competitive ladders online all release dopamine or that feel-good chemical. Especially when things are designed to keep you addicted, this can be extremely potent. This is why microtransactions in children's games are such a big deal. Psychologists are hired to make these as addictive as possible with randomization, streaks, and progression, and when you combine these with kids who don't fully understand money, you can get them spending thousands of dollars they may not have. I want to close by discussing the word drug. It has very negative connotations like the phrases drugging someone or doing drugs. But asking if drugs are bad is like asking if water is bad. You can drown in it, but it also keeps you healthy. So why does this distinction exist? Well, here's my guess. You often hear alcohol and cigarettes as being apart from drugs. To say that these are safer to consume, we need dangerous things to compare them to. The alcohol industry was valued at $1,639.9 billion in 2023, and nicotine is estimated at $965 billion for 2024. More food for thought. And that's all I have for today. Thanks again for listening to Help I'm Teaching. I now have a WordPress for all the transcripts. The links to those should be in the updated descriptions of each episode. See you next month.